Good morning, everyone. This is Amy Stevens at Health Policy Institute of Ohio. Welcome to the first work team meeting for the Community Conditions Group for the State Health Improvement Plan, which is work that we're facilitating on behalf of the Ohio Department of Health. For now, everyone on the call is muted just so we can keep those lines clear, but we do want this to be an interactive meeting. So throughout the call today, please type your questions, thoughts, ideas into the question box. And if you want to speak up, please raise your hand and we will unmute you. If you have muted yourself, you will also need to unmute yourself. And in order to speak to the group, you'll have to have entered your audio PIN. It works best if you log in first and then enter your audio PIN so that we can hear you. All of the slides and materials for this call are posted on the HPIO Shaw Ship page under the header for the Community Conditions Work Team meeting for today. So if you want to refer to that information as we go through or flip back to previous slides, you can follow along with that information as well. Here is the overall chart of stakeholder engagement for the State Health Assessment and State Health Improvement Plan. And this is the Community Conditions Work Team. You can see that red box around the group at the bottom there. And you should be able to see the list of attendees on this webinar in the box to the right on your screen. So that you can see everyone that has called in today. And here at HPIO, we have Reem Ali, who's going to be presenting on the webinar. Zach Reet is going to be joining us, and he'll be presenting on the webinar. And then we have Alana Clark-Kirk and Austin Oslak here with us as well. So we're really happy to have all of you on the call. It looks like we have a great turnout, 37 people so far. So that is fantastic. This is the agenda for our call today. We'll start with some level setting just to make sure everyone has the basic information on the Shaw and Ship process. Then we'll look at the results of the prioritization survey that many of you filled out a few weeks ago. And then we'll get into a prioritizing discussion. We have one objective for the call today, which is that we will have guidance needed to finalize the list of desired outcomes and indicators in the community conditions category for the SHIP. So we're not making any final decisions on the call today, but the feedback that we get from all of you will help us to narrow things down and have that final list of indicators on hand in time for the July meetings. We're doing this so that we can develop SMART objectives for community conditions, and I'm sure many of you are familiar with SMART objectives. They are specific, measurable, achievable, realistic, and time-bound. And this is an example of what we mean by a SMART objective. These are from the 2017-2019 SHIP. So you can see there's a specific indicator with a source, a priority population, baseline data, and targets. So our goal is to develop something similar for community conditions. Today, we're going to be talking about desired outcomes and indicators, and then at the next round of meetings, we'll be talking about priority populations and targets. I'll start with a brief recap of the June 4th Advisory Committee meeting that I know some of you were at that meeting, but not all of you were able to be there. So first we want to get a sense of how many of you were at that meeting. So we're going to throw up a poll here. And the question is, did you attend the June 4th Advisory Committee meeting? Yes, I was there and was in the community conditions small group discussion. Yes, I was there, but not in the community conditions small group discussion. Yes, I joined by phone. No, but I reviewed the slides and materials, or none of the above. So please take a minute to fill out that poll. What we're talking about today really builds on a whole series of advisory and steering committee meetings that started at the end of 2018. Okay, here are the results of the poll. So it looks like about a quarter of you were in that community conditions small group conversation that we had. So that'll be helpful because we'll be building on that conversation. But then many of you also are newer to the process. So we're delighted to have new folks aboard for the SHIP process. Please make sure that you go back and review the materials on the HPIO SHA SHIP page so you can get up to speed on the work that's been done so far. At the June 4th small group discussion on community conditions that Reem and I facilitated, we had a great conversation about how challenging it is to narrow down the priorities within community conditions because all of these things are so important and so interrelated. And so we talked about the importance of focusing on outcomes that are measurable at the local and state level and are budgeable. So things that we can imagine measurable progress in the next 3 to 6 years and have alignment with other things that are happening in the state. So that's just a quick recap of what we talked about at that June 4th meeting. Another thing we did at that meeting was to celebrate that the state health assessment is just about done. We started the state health assessment process in October of 2018 with 5 regional forums, and the report on that component was released in December. And then ODH will be releasing the SHA summary report and the online SHA in mid-July. So be watching your email for that to see that final version. There is a draft of the SHA summary report that's posted in the materials for this meeting, and we want to get a sense of how many of you are familiar with the SHA summary report. So we're going to put up another poll here. Have you read the draft 2019 SHA summary report? So yes, I have read all 40 pages. I have read the 2-page executive summary. I've skimmed it or not yet. Okay, we're gonna put up the results here. Great, so a third of you have read the full report and some of you are less familiar with it. So again, it's great to have new folks aboard in the process. And please make sure that you review the SHA document that's posted on the website because the conversation that we're having today builds upon the results of the SHA. Moving along, take a look at the overall timeline for the SHIP. So here we are in June on the left with this first round of work team meetings. The next round of meetings will be in July, and the end goal is that the SHIP will be disseminated this fall. And this work is being done in alignment with a maternal and child health assessment as well. Now we'll do a quick reminder of the purpose of the SHIP, and it's really about getting all of us rowing in the same direction to improve population health. And that's why it's so important for us to be concise and prioritize toward common goals. Prioritizing is certainly difficult work. These are challenging conversations, but it's necessary if we're going to be strategic about working together to improve outcomes. The SHIP will be a tool to align state agencies, and these are agencies that are participating in the steering committee for the SHA SHIP process. The SHIP is also meant to be a tool for local partners to drive stronger alignment and collaboration between all the types of organizations and sectors listed here and other local partners that you might be working with. And the SHIP is really about tracking our progress over time and being able to produce annual reports that check in on how we're doing on our priorities and communicating that clearly to all of our partners and stakeholders. So this is from an initial look at objectives from the last SHIP. And on this chart, green indicates things are improving, yellow means we have little or no detectable change, red means things are getting worse. Obviously, this preliminary look is somewhat discouraging, but the goal of the SHIP is really to get us into the green. So that is what we're going for. It's really all about driving improvement. And the goal is to ensure that all Ohioans have the opportunity to achieve their full health potential. So this means eliminating disparities and inequities and achieving health equity. At the June 4th meeting, Reem provided an update on the maternal and child health and maternal, infant, and early childhood home visiting projects, henceforth referred to as MCV. And they are in the process of identifying priorities, and we are working in tandem with the MCH MCV steering group and stakeholders. These are the things that have been rising to the top so far, but this process is ongoing. Just last week, we had a meeting with the ODH Division of Child and Family Health staff that gave their input on community conditions priorities, and Reem is going to share that in a minute. Important to remember that these priorities are focused on the MCH population. Now we'll take a look at the SHIP framework that's guiding our overall work. This is the new framework. It is still under construction, and the yellow boxes are the things that are still under construction, including what we're going to be talking about today. If you were familiar with the previous SHIP framework, you'll notice that this is somewhat different. We made some revisions to, first of all, flip the SHIP. So putting that stronger focus on community conditions, health behaviors, and access to care. We also simplified the language. So those questions across the top are intended to help folks who might not be from a public health background to understand the SHIP. And then we also elevated equity to put a stronger focus on that throughout the SHIP. Here's where community conditions lives in the framework, so that red box in the top left. And throughout our conversation today, please be thinking about how community conditions intersect with the other topics listed on the left, and also how it contributes to the outcomes in green and in orange. These are the main components of the SHIP. So those specific and measurable objectives, priority populations, those are groups with worse health outcomes, evidence-based strategies, and strategies to reduce disparities, inequities, racism, and discrimination. Today, we're focusing here on the SMART objectives, and then in July, we'll be talking about priority populations, and through the end of the summer, the focus will be on strategies. Again, this is the objective for our call today, so that we can get to the point of having SMART objectives for community conditions. And now I'm going to turn it over to Reem, who's going to talk about the results of the prioritization survey.
Good morning, everybody. It is great to see so many folks on the call and from diverse backgrounds. As Amy mentioned, this is Reem with HPIO. Today is really all about narrowing down and prioritizing. And so we will be doing that and getting into some robust discussion in the next few minutes. These are the sources of information that we are drawing upon to set the SHIP priorities. We looked to local input through the regional forums and also reviewed data in the online SHA. And we also gathered feedback and input from all of you through the steering and advisory committees, both the SHA SHIP steering and advisory committee, and then the maternal child health and MCV steering committee. In addition, we have gathered feedback from that meeting on June 4th through the SHIP prioritization survey. We also, as Amy mentioned, gathered feedback from the Division of Maternal, Child, and Family Health at the Department of Health. And then, of course, we really want to help to move the conversation along and solidify some of the desired outcomes that we are looking to within the community conditions category through our conversation today. We are really excited to hear from all of you today. You all are the subject matter experts on these topics and the people with the passion and knowledge. So really excited to get into this discussion. First, I want to share the results of the SHIP prioritization survey with all of you, which was filled out by a somewhat wider group. And of course, our task today will be to narrow the topics under community conditions a bit further. We used the results of the small group discussions on June 4th to craft the prioritization survey, which we sent out the following day. It went to all members of the SHA SHIP Advisory Committee, Steering Committee, and the MCH MCV Steering Committee. A total of 55 people completed the survey. Our task for narrowing down community conditions was a bit more difficult since we started with a list of 7 potential subtopics, and the prioritization survey asked folks to prioritize their top 3 subtopics to include in the SHIP. And you can see here the results. We are going to focus on the top 4 community conditions for discussion today: housing, economic conditions, violence and trauma, and education. And our goal or objective will be to narrow down to one desired outcome to address in each of these 4 buckets. As Amy mentioned, the SHIP is being developed alongside of the MCH MCV assessment. To strengthen alignment between the SHIP and the MCH assessment, we also asked ODH, Division of Maternal, Child, and Family Health staff to weigh in on the top 3 subtopics to include in the SHIP as well. And we gathered feedback from 41 staff at the Department of Health. Here are the results for what they selected as the most important community conditions to address in the SHIP. And you will note that there is a great deal of alignment between what was selected by staff and also through the SHIP prioritization survey, which really just reinforces that these are indeed a strong set of community conditions to focus on. Amy shared the updated conceptual framework, and I want to provide an update on where priorities are shaping up for other areas. As Amy noted, nothing is final. The yellow on the framework indicates that things are still under construction. Under mental health and addiction, we expect that things will mostly stay the same, although there will be a likely added focus on youth drug use. For chronic disease, again, mostly the same, although there is consideration of adding lead poisoning and bundling that with child asthma in a category called childhood conditions. Just wanted to note that oral health will likely be included as a strategy to reduce heart disease. Under maternal and infant health, there is strong interest in adding maternal mortality and morbidity data if that is made available, which would then replace low birth weight. And there is also some discussion of renaming the category. We are focused on the community conditions discussion today, so we'll have some updates post this meeting on that. Under health behaviors, the group actually discussed yesterday, was convened yesterday, and we'll be focusing on tobacco use, nutrition, and physical activity. Under tobacco use, there'll be a focus both on youth youth use, including e-cigarettes and adult use. And then within access, the group was convened and expressed a desire to focus on health insurance coverage, local access to healthcare providers, and unmet need for mental health. I'm going to be reviewing some of the considerations for prioritizing desired outcomes to help guide us in our discussion this morning. For the desired outcomes we include in the SHIP, we've identified a set of prioritization criteria. The criteria include ability to track progress, so ensuring that there are measurable indicators available to assess and report progress in a meaningful way on an annual basis, ideally both at the state and local level. Also looking at the potential for impact, so the availability of evidence-based strategies and the feasibility to address these issues at either the state or local level. And then also taking a look at connection to the SHIP health outcome priorities, so the extent to which the health factor, in our case, the community condition, contributes to the mental health and addiction, chronic disease, and maternal and infant health outcomes. Examining the nature of the problem, so taking a look at the magnitude and severity of the problem, and then also ensuring that there is alignment with both priorities that have risen to the top at the local level with the MCH and McVie assessment, as well as other state agency plans and other initiatives. Through the SHA findings and various meeting discussions, we've really focused on the last three criteria: connection to SHIP health outcome priorities, nature of the problem, and alignment. And today we'll be sharing more information to guide the discussion focused on ability to track progress and potential for impact. I'm going to pause here and just see if anybody has any questions before moving on about our objectives for today. And if you do have a question, please type it into the question box. As a reminder, our focus today is on identifying one desired outcome within violence and trauma, education, housing, and economic conditions. All right. We're gonna move on with a first focus of violence and trauma. And here are the desired outcomes that we're considering for violence and trauma: decreased adverse childhood experiences, decreased child abuse and neglect, decreased violent crime, increased neighborhood safety, and decreased intimate partner violence. I'll talk through some of the pros and cons of selecting these desired outcomes, focusing on ability to track progress and potential for impact. Here are the sources for the indicators that we will be reviewing for violence and trauma. I'll be touching on the pros and cons of these sources as we move through discussion of each of the desired outcomes. Just give you a second to review. All right, so we are, just to set this up again, going to review each of the desired outcomes and potential indicators. Then we'll provide some opportunity for discussion. And then we will be polling you to see which desired income you think should really rise to the top for violence and trauma. So starting with decreased adverse childhood experiences, there is one indicator that we can use to measure adverse childhood experiences from the National Survey of Children's Health. A pro of this measure is that the data is available on an annual basis through the National Survey of Children's Health, because the data is collected as part of census data. A con to this is that data is not available at a local level, and for the past 2 years, this survey has had a small sample size, which means that data can be disaggregated at times for some populations, but data for some groups may be unreliable. Data is also parent reported for this measure, which may lead to underreporting. Another issue important to highlight is that this is a composite measure that includes 9 separate items. And here are the 9 ACE items that are included in the NSCH ACE metric. Because this is a composite measure, it makes it harder to impact since there are so many factors that are included as part of this ACEs measure. There is no one strategy that can move the needle on all 9 of these items. However, there are specific strategies that can be implemented to address a specific ACE. So for example, Zach will talk about strategies to improve economic conditions a little bit later on this morning. And I'll be discussing several strategies that can make an impact on the violence-related ACEs. Of course, strategies to address mental health and drug use will be addressed in other parts of the SHIP. Moving on to our next potential desired outcome, decreased child abuse and neglect. There are 2 indicators that we are looking at here. A pro is that both these measures come from administrative data as opposed to survey data, which carries with it a lower level of subjectivity. And it may be possible to get similar data at the local level from the Department of Job and Family Services. One issue with this, however, is that because it is administrative data, movement can be influenced by various rules, regulations, processes, and procedures, and it really could be difficult to ascertain whether improvement on these measures is a result of the implementation of an effective evidence-based strategy versus an administrative process or procedural change. Another pro to this desired outcome is that there are strategies that have strong evidence for reducing child maltreatment, and that includes evidence-based home visiting and early childhood education. This measure is also a priority rising to the top for the maternal and child health population, so can help strengthen alignment between the SHIP and the MCH assessment. Moving on to our next potential desired outcome, decreased violent crime. Here are several indicators that we can use to track this desired outcome. Pro is that data is available at the local level and includes both physical and sexual violence for these measures, but a con of the data, particularly for the violent crime rate, is that it is voluntary reporting by law enforcement agencies, and only 60% of law enforcement agencies in the state report on the violent crime data, covering only 80% of Ohio's population. Now I'm going to hold on talking about potential strategies to impact violent crime until I review the remaining 2 desired outcomes, because the strategies to address violent crime, neighborhood safety, and intimate partner violence overlap quite a bit. Here is an indicator that can help us track progress on improving neighborhood safety or increasing neighborhood safety. A pro of this measure is that it is available on an annual basis through the National Survey of Children's Health, and the cons are similar to the ones that I described for the ACEs measure. Data is not available at a local level. Sample size has been small over the past 2 years, and there may be, although sometimes data is available disaggregated, other times the data is unreliable due to that small sample size. And then the final desired outcome that we are considering is decreasing intimate partner violence. There are several metrics that we can track improvement over time on related to intimate partner violence. And of course, each of these specific measures has its own pros and cons. For example, a focus on intimate partner related deaths may undercount the prevalence of intimate partner violence. However, lifetime prevalence through the NISVIS, or the National Intimate Partner and Sexual Violence Survey, is not a truly budgeable measure, since it's accounting for any exposure to violence over a lifetime. Also, data from this source is not available at the local level, and the most recent data from this source is 2015, so we do not at this time have the ability to do annual updates. Another measure that's included on here is intimate partner violence that comes from the Ohio Pregnancy Assessment Survey. A pro for this measure is that this is a particularly important population to focus on as we think about impacting infant mortality and maternal mortality. And then we are also considering measures from the Youth Risk Behavior Survey. And potentially there could be measures around youth dating, sexual and physical violence, and that is a survey of high schoolers. However, we are still waiting to hear if data will be available based on sample size, and we would not know that until later this year. As I mentioned, there are several evidence-based strategies that can be deployed to address all three of these desired outcomes: violent crime, neighborhood safety, and intimate partner violence. And there is quite a bit of overlap on what those strategies are, which is always good to get a bigger bang for your buck when identifying strategies in the SHIP. All right, so those are the 5 desired outcomes that we have identified for the violence and trauma subtopic under community conditions. Before we vote on which desired outcome should be included in the SHIP, I want to give you all an opportunity to discuss, voice your thoughts, give some feedback about which one you think is most important, and also take this opportunity to ask any questions of clarity or clarifying questions around these outcomes. All right, we have a question about OPAS. Is the intimate partner violence available on an annual basis? And yes, it is. There is an annual update. This is a state-administered survey that is comparable to the National Pregnancy Risk Assessment survey. Please make sure that you raise your hand if you have a question and type it into the chat box, or raise a hand just to speak. You don't only have to type a question into the chat box. You can, into the question box, you can raise your hand and we will unmute you so you can take part in the conversation. Okay, so Deborah, it seems like you have your hand raised. If you could please put in your audio pin, we'll be able to hear you. Okay, and we have another question. And this is from Amanda. It says the IPV indicators don't capture violence against men. Are there any data sources that provide data about IPV for the entire population? OPAS covers specifically violence against women. What percentage of intimate partner violence is committed against males? And what do we lose in that regard by using OPAS rather than the other measure? That's a great question, and the National Intimate Partner and Sexual Violence Survey is also specific to women. And all right, when we have several hands raised, I know that we have some intimate partner violence experts on the line, so I want to make sure that they can also respond to this comment. I think Deborah, can we get?
Can you hear me? Oh, hello.
Yes, we
can you
can
hear me
hear you.
now? Okay, sorry about that. Yeah, so I guess I had 2 things that are kind of more comments. One is just the concern around especially the IPV, but that the better we do it sometimes at some of these, at raising information about some of these, the more things go up rather than down. So that would be a concern. And then kind of on a plus side, with the one around decreasing child abuse and neglect, that one to me is the one that the strategies that you talked about are most likely to make a difference in the time frame that we're talking about. I just wanted to throw that out there.
Great. Thanks, Deborah. Okay, and I think James also has his hand raised. We're going to unmute you.
This is Jim Watkins. As you were going through the intimate partner violence data, was I correct in hearing that the data is not, you can't really bring it down to the local level, and also that it's not, you don't have it updated very often?
Thanks, James. So your question was regarding the IPV data and whether or not it was available at a local level, and I think it was the annual update. And so for sure, for the one that is lifetime prevalence, that is not available at a local level. And the last time that the data was updated was in 2015, which does give us some concern on whether or not we'd be able to get more recent data for the SHIP. In regards to the intimate partner related deaths that comes from the Ohio Violent Deaths Reporting System, that data is updated annually and it can be available at the local level. Okay, I'm first going to take another question. I think maybe this is a comment from David Ellsworth. It was difficult to determine which of the indicators mentioned is the most measurable. Does HPIO or any of the experts on the call have insight on which indicator would be the best to track over time? And David, I'm going to ask you to clarify, do you mean across the board, across the desired outcomes, or within a specific desired outcome category? Because I think the answer would be harder to assess if we're talking across desired outcome categories, but more easily able to evaluate if we're talking about a specific desired outcome category. So if you can either you can feel free to raise your hand and you can clarify, or type into the question box. We do have a few other raised hands that we'll go to. Teresa.
Good morning, everyone. My question
And
is,
folks that are speaking up, folks that are joining the chat and talking, please make sure that you are speaking up so that we are able to hear you, though the voice is coming across a bit soft.
okay, sorry. Hope you can hear me. My question is in regards to violence, and recently in the news, the national news, and I think here locally, we've heard a lot about violence against the LGBTQ community, and especially transgender women and trans individuals, especially African American. And I'm wondering, in these databases, do we collect any data that would help inform any type of interventions, or, you know, just our knowledge about how prevalent that violence is?
So that is a great question, Teresa. Thank you for that. As far as we are aware of, there is no data that disaggregates violence for the LGBTQ population. The one source that we have been able to identify is BRFIS, but it does not have a measure that would allow us to get to violence experienced by the LGBTQ population. So if anybody on the call is aware of other data sources that might allow us to get to that, please do let us know. Any other questions? Oh, okay. There is a comment. There is a national organization that collects LGBTQ plus violence. There may be, we want to make sure that we have data available at the state level, and so there is national data that is often available, but not data available at the state level. Okay, and then David, you said within the desired outcome category, and I think maybe you were talking about the IPV category. Correct me if you are wrong on that. Of the IPV category, the two indicators that yes, you're saying yes. Okay, the two indicators that probably would be most easily to track progress on would be intimate partner-related deaths, and then the measure from OPAS, from the Ohio Pregnancy Assessment Survey. The YRBS data could be helpful, but sample size seems to be an issue. There is another question. How will the strategies listed for reducing child neglect affect the number of children in foster care? Why use the number of children in foster care as an indicator? And this is from Amanda. So the number of children in foster care is certainly associated to child abuse. And so neglect, children that are in foster care are often either have experienced child abuse or some form of neglect, and so that is why that indicator is one that is included. And certainly the strategies that address child abuse or reduce the prevalence of child abuse could have an impact on the number of children that then enter into the foster care system. Any other questions or comments? Anybody else that'd like to speak, you can raise your hand. Everybody's ready to get polled? Oh, okay. Thank you, Ani, for sharing that source. We'll take a look at that. Okay, we are going to launch into a poll. You will be asked to select your top desired outcome under violence and trauma. So taking into consideration the prioritization criteria, particularly ability to track progress and potential to impact. For child abuse and neglect, there were evidence-based strategies that could be deployed, as well as violent crime, neighborhood safety, and intimate partner violence. There was quite a bit of overlap in the strategies that could be deployed to move those outcomes. And we want to make sure that everybody votes. So we are going to maybe pause a little bit longer on this to ensure that everybody has the opportunity to vote. This will provide us with guidance on the desired outcome within violence and trauma, and then there will be more work to identify the best measure that we will use to then track progress on that desired outcome. Okay, looks like we've got everybody weighing in. And decreased adverse childhood experiences was selected, followed by, well, it's pretty high, so the majority focused on that, and then followed by the other measures. So we will note that, and then we'll be also exploring about ways to think about the best way to move this measure. Just want to open it up for a bit more dialogue on thoughts to address. So we shared that this measure in particular is made up of 9 items, so it's a composite measure, and to track change over time is going to be difficult. So to see progress on this measure is going to be difficult because there are so many ACEs that are included. Is there thoughts on how we should address this measure or how to move impact? And I'm going to see if I can go back to that slide that shows all of the ACEs. Okay, so you see those 9 ACEs there. everything from income hardship to racism and discrimination. So we have a comment here, a pure count on the number of ACEs a child has or is experiencing. As opposed to a percent, as opposed to a percent of two or more. Okay, that is something that we could certainly consider. Thank you, Chad. Any other thoughts on that? Can you show the slide with the frame around specific ones? Absolutely. And these highlight the strategies, the ones for which we know there are strategies to impact that we discussed this morning. So Zach will be discussing income hardship. I discussed strategies to address violence. There are going to be other strategies included in the SHIP to address mental health and drug use. And so there's a comment here that we could consider monitoring each ACE individually. And that is certainly something that we can consider and discuss as well. There may be some limitations with data availability for tracking each ACE separately, so we'll have to take that into consideration. And witness of domestic violence might overlap with child abuse and neglect without stigma. This is from Deborah. There certainly is overlap in the populations that experience these different ACEs. And so it's just going to be thinking through the most strategic way to approach. There's a comment about incorporating the ACE items into the YRBS survey in future iterations. I think certainly something that ODH could consider as well. Are we able to get additional data from other sources since the sampling pool may be somewhat small? And this is from Shell. Unfortunately, with the ACEs data, the only other source is BRFIS. And BRFIS is reporting by adults. It's retrospective. And so there really is no way to impact through the SHIP. And so this is the best measure of ACEs that we currently have that is available at a state level. Ilka, your question about what is being measured for income hardship, that is a question on the National Survey of Children's Health that is asked of parents of, I think something along the lines of if they're having difficulty getting by on the income that they have. So I think that is how the question is framed on the survey. Marie, you have said if we focus on the three in the red boxes with the ACE data, can we know if ACE score includes these three? We can take a look at the ACE percentage for those expressing income hardship and witnessing violence. I am not sure if we can create our own composite measure of those three categories. I don't think that that is possible. We could track each one separately. And then something again from Chad, just something for future thinking. With the increased prevalence of the usage of the ACEs assessment, there could be potential of standardizing the assessment of a subpopulation of youth and getting annual data from a state source. And there is potential for that. I think that's something that certainly would be helpful if this is included, and for future SHIPs to consider including that. And I think I can't remember who mentioned potentially including it as part of YRBS could be an opportunity for future SHIPs in tracking measurement. Okay, I think that those are the comments that I see. Thank you all. That was very helpful to think about other ways to display the data. And now we will move on to our other community condition subtopics. I'm going to hand it back over to Amy Bush-Stevens.
Great, thanks, Reem. I'm going to move us on to talk about education. Move our slides forward here. All right, so these are the desired outcomes that we're considering for education. Increased preschool enrollment, increased kindergarten readiness, improved third grade reading or other academic proficiency, decreased chronic absenteeism, and increased educational attainment. Here are the sources for the education indicators. And an overall strength of including education in the SHIP is that education outcomes are very measurable. And for the Ohio Department of Education and Department of Higher Education data, the last two rows here, they have already set targets for some of these indicators in their own plans. And so we could pull those targets into the SHIP, and that would provide some really nice alignment between the SHIP and education plans. Another important strength is that data from these sources is available, broken out by race, ethnicity, disability status, economic disadvantage, and at the local and state level. Now I'll talk through some of the pros and cons of selecting each of these outcomes, focusing on an ability to track progress and the potential for impact. Here are the potential indicators for the first two desired outcomes. For preschool, one pro for this is that it is census data, so it is available on an annual basis and at the county level. On the downside, we don't have information about quality from this measure. We've also heard feedback that some don't like the preschool label because that's too narrow, but that's how it comes from the Census Bureau. And then another downside of this is that it's really more of a strategy rather than an outcome. Looking at kindergarten readiness, on the upside, the ODE data is available on an annual basis at the state and local level, broken out by race, ethnicity, gender, and economic disadvantage. On the downside, the categories for kindergarten readiness are sort of in education jargon. So the categories are demonstrating, approaching, and emerging. So it just might take a little more work to communicate that one. And these are some strategies, just examples of a few strategies related to these desired outcomes. Looking at preschool, a pro here is that we can certainly envision efforts to increase access to preschool through state or local funding. There's certainly work being done on that around the state. And there are co-benefits from other outcomes that Reem covered when she was talking about violence. A con for both of these is that these are expensive strategies. For kindergarten readiness, a pro is that this strategies can encompass a wide range of approaches for perinatal through age 6, including physical and emotional well-being. And it looks like we have a few questions here already. What about restraint and seclusion data? That may be available from the Ohio Department of Education, so we can certainly look into that. Can we get data on inclusion of kids with disabilities in general mainstream classrooms and enrollment of kids with disabilities in typical preschools for school readiness? I am not quite sure what the answer is to that question. When we're talking about preschool data, it's not quite as readily available as for K-12 data from ODE, but we can certainly look into that. And if there's anyone on the call who has any information about that, please let me know. Okay, and then a comment from Jim Watkins, is this data available down to the census tract level? That is a good question. I think that the preschool enrollment, it may be. Not quite sure. Yeah, it might require more in-depth analysis, but we can look into that further. Okay, and just another point about children with disabilities is that if we go with something that is from the Ohio Department of Education, we might be able to identify priority populations for children with disabilities and have some specific targets and strategies for children with disabilities. Okay, from Shelby Edwards, we can look into both questions. We have restraint and seclusion data, don't know the frequency of reporting, so we can look into the details and share back with you. Great, thank you so much, Shelby. We look forward to seeing that. From Ashley, what was the question asked if someone else could help answer? Not quite sure if that's referring to a question from me. We haven't gotten to my question yet. I'm going to run through the pros and cons of the different indicators for education, and then we will get to the polling. Oh, maybe it was referring to the question about census data. So the question was, can we get preschool enrollment or kindergarten readiness data at the census tract level? I highly doubt that the kindergarten readiness data would be available at the census tract level, but preschool enrollment is possible, and we will look into that. From Amanda, is there an indicator for cost of childcare? Good question. We will look into that. And a question from Ashley. Okay, got it. All right, I'm gonna keep moving on to the next outcome. Okay, so this is looking at third grade reading and other educational proficiency. So for third grade reading, a pro is that this is a high visibility indicator. It's easily understood by the public, and we have annual disaggregated data available, and ODE has set a target. For the composite measures for math or English language arts proficiency for grades 3 through 8, the pro for this is that it's broader, it's including more grade levels. ODE has also set targets for these. A con is that it may be harder to see change over time since we're looking at a broad range of ages. Here's some examples of strategies to reach this desired outcome. For third grade reading, a pro here is that focusing on strategies for early childhood and grades K through 2 are certainly a very important population that's been getting a lot of focus and momentum around the state. Here is the indicator for chronic absenteeism. A pro for this one is that it's included in ODE's ESSA plan, the Every Student Succeeds Act plan. So they have a target, and we can get this data disaggregated. A con is that combining K through 12 may be a little broad since strategies would need to be different for middle school versus high school. Here are some examples of strategies to reduce chronic absenteeism. On the upside here is that the Department of Education and the Department of Medicaid have been working on school-based health centers. So there's some momentum for that around the state, and certainly some local communities that have really embraced school-based health centers. And the Department of Education recommended that this would be a good one to include in the SHIP because of the clear connection with health. Okay, we've got a question here from Taylor. Are any measures, strategies looking at health literacy specifically? I don't think we saw health literacy as a specific strategy to achieve these outcomes, but it's certainly something that could be considered as a strategy, maybe for the health behaviors area. Okay, moving on to educational attainment. Here's the indicator for educational attainment. So a pro for this one is that the Ohio Department of Higher Education has a target for this. This is called Ohio's attainment goal. And also good to point out here that this is not just focused on college graduation, so it acknowledges the role of other post-secondary options. On the downside, the state level data for this specific indicator, it's only available at the state level. To look at county level data, we'd have to use a slightly different indicator. Here are examples of strategies to reach Ohio's attainment goal. On the upside, there is a lot of momentum right now and some good political feasibility for these types of strategies. All right. We are now, before we move on to asking you to vote on these outcomes, I want to pause here and see if there are any additional questions or comments. Again, we encourage you to raise your hand or use the question box. So I'll pause here a moment. All right, I'm not seeing any thing in the question box, but we encourage you to raise your hands if you'd like to speak. Here's a question from Amanda. I know the strategies are meant to be education focused, but they really should align with broader social determinants of health strategies. Kids can't focus if they are hungry or homeless. And absolutely, as we think about how all of these community conditions are linked together, in a minute here, Zach's going to be talking about economic conditions and housing, and we can certainly think about how those factors contribute to educational outcomes. So that's a great point. And we have comment here from Deb Seltzer. For me, the strategies that get at chronic absenteeism go to the reasons why this topic is important for the SHIP. Okay. And Wallace Chambers, when addressing chronic absenteeism, are we looking at housing interventions, bullying, etc.? So if we selected chronic absenteeism as the indicator for this area, we'd be looking at a wide range of strategies. So just want to emphasize that the strategies that I shared on the slides here today are just a few examples that we pulled in looking at what the evidence indicates is most effective, but we, at those meetings that we're having towards the end of the summer, so the meeting that we'll have in August for the community conditions group is where we'd really dig into what are the strategies that need to be implemented to reduce chronic absenteeism. Okay. Any other folks want to raise their hands? Okay. Another important thing to think about is the idea of co-benefits or selecting strategies that impact multiple outcomes that we're interested in. And so I think there are a lot of really great examples here of that. For example, a lot of the early childhood focused strategies have positive outcomes related to violence, related to kindergarten readiness, or these other education outcomes related to economic outcomes. And so I think there's a lot of opportunity within this category of community conditions to draw some of those strong connections. All right. We have Shell Nichols has raised their hand, and we need you to enter your audio pin so that we can hear you. So please enter your audio pin. We're not able to hear you yet, Shell. You can use the question box instead if you're not seeing that audio pin. Okay, Shell, go for it.
Can you hear me now?
Yes, thank you.
I just wanted to make note of that the chronic absenteeism is a huge challenge in regards to providing whole school, whole child interventions, K through 12. And I just mentioned that simply because this would be an additional work group to try to tackle chronic absenteeism in terms of looking for more research-based strategies. I think our remaining discussion points all deal with when students arrive at school. And so we talk about chronic absenteeism. And I just want to note that I work at the Health Department of Education. We are looking at all types of barriers that keep students from going to school on a regular basis and or leaving school or transient population for students.
Mm-hmm. Okay, great. That's great context. Thank you. Okay, I'm going to move us along to putting up the poll for education. Here we go. Drum roll. All right, so which of the following outcomes should be prioritized in the SHIP? Increased preschool enrollment, increased kindergarten readiness, improved third grade reading or other academic proficiency, decreased chronic absenteeism, or increased educational attainment. This has been a great conversation so far. I think we've had the most interaction on this work team call compared to the previous two work team calls. So we really appreciate everyone giving their input. We want everyone to vote. Want to hear from all of you. So we're going to give it a minute here. I know these are tough choices. Counting down here. Okay, here we go. Alana's going to share the results. Okay, so strong focus here on chronic absenteeism, followed by kindergarten readiness. Okay, thank you, everyone. And now Zach is going to take the helm and talk about economic conditions and housing.
Thank you so much, Amy. And I just want to echo Amy's thanks for the participation and engagement on today's webinar. It's really been wonderful to hear all the different perspectives. I would like to invite you, though, we've been on this webinar for an hour and 10 minutes together, to join me in standing up and maybe even getting a little physical activity as we go through these next few slides. So I'm going to be talking about the desired outcomes that we are selecting from in housing. Just a general observation about these outcomes. It seems that we have an outcome that is far upstream in increased housing affordability and quality, a couple outcomes that are a little further downstream in decreased evictions and homelessness, and then one outcome that may or may not be better treated as a strategy to improving housing affordability and quality in increased home ownership. But to get on to the specific pros and cons of these strategies, the data sources for the housing related metrics are the ACS and the Ohio Housing Finance Agency, which largely uses data from the ACS called the Comprehensive Housing Affordability Strategy data. One con of that data is that the most recently available currently is 2011 to 2015, so there is some data lag, but pros are definitely that this data is updated on a regular basis, it's available at the local level, and it can be disaggregated for subgroups. The first desired outcome we'll look at is increased housing affordability and quality. And the indicators we have here are the percent of renters experiencing severe cost burden, meaning that they spend over 50% of their household income on gross rent, and then percent of households that have one or more severe housing problems. And just to keep the slide readable, I kept those housing problems off, but I'll read them to you now. The 4 severe housing problems are housing units that lack complete kitchen facilities, housing units that lack complete plumbing facilities, households that are severely overcrowded, and then households, again, experiencing severe cost burden. When we think about potential to impact increased housing affordability, one of the pros is that we do have evidence-based strategies to pursue in the state, and many of these strategies have some traction here in Ohio. Those include increasing investments to the Ohio Housing Trust Fund, investing in home improvement loan and grants to improve the quality of housing, to use healthy home environment assessments to go in and look at housing quality issues directly associated with health outcomes, and then inclusionary zoning or other practices that help move people with lower incomes into higher quality neighborhoods and help to address housing affordability in those areas. The next outcome, which I mentioned is a little further downstream, is the number of eviction filings per 100 renter households. This again comes from the Ohio Housing Finance Agency. The data is updated updated annually, and it is available at the county level. One potential con of selecting this this outcome and this indicator is that evictions are a tip of the iceberg issue. Not all eviction or forced move actions are filed in the courts, and so it may not be collecting a full scope of the problem. There are evidence-based strategies to decrease eviction, including providing debt advice to tenants with unpaid rent, and then ensuring legal support for tenants in eviction proceedings. Another potential pro of selecting this outcome is that this is an issue that is budgeable. There's some evidence out there about disparities between cities, and there is, as I already mentioned, these evidence-based approaches to reducing evictions. The next outcome that we'll be talking about is decreased homelessness, again, a downstream indicator of housing affordability problems. One indicator that we have here is a count of people experiencing homelessness from the U.S. Department of Housing and Urban Development's point-in-time count. For priority populations, there is also a measure that comes from the Ohio Pregnancy Assessment Survey that looks at the period 12 months before pregnancy and asks if women who experienced homelessness during that period. There are evidence-based strategies, again, to decrease homelessness. These programs are alive and well throughout communities in Ohio, so there is an opportunity to expand. Rapid rehousing, service and enriched housing, and housing first are strategies all specifically rated to decrease homelessness. The last desired outcome we're prioritizing today, again, I mentioned maybe more of a strategy to address housing affordability and quality. I'll be interested to hear experts' perspectives on that. But there are several metrics that we could use to track increased home ownership, including the percent of households that are owner-occupied. Again, these metrics are updated annually, and there is local level data available. Two of these indicators are indicators, though, of troubled or housing instability within homes that are owned or owner-occupied, excuse me. In What Works for Health, which is the evidence registry that we rely on heavily in developing the SHIP, there are no strategies that are specifically rated to increase home ownership. There are strategies that do address barriers to homeownership, such as wealth accumulation or the ability to save for down payments. And so selecting this desired outcome may mean a need to look more at those downstream strategies. And it looks like we have a question that's come in. And this is a observation from Tom. The Ohio Housing Finance Agency is now managing the statewide homeless data warehouse and should be able to provide annual versus point-in-time data on numbers experiencing homelessness. Annual is a much better indicator than point in time. So thank you very much, Tom, for bringing that into the conversation. It's an important piece of information to have as we select these outcomes. We have a question here from Amanda. Is Ohio Housing Financing eviction data available by race? It is not, I believe, in the housing needs assessment. I believe that we do have a representative from Ohio Housing Finance Agency on the call. If you know whether or not that data is available by race ethnicity, please do let us know. Yes, and so the question is, sorry, we're translating a question from email here. Is the question is, are apartments included in the housing affordability desired outcome? And yes, that outcome of increasing housing affordability and quality was not meant to specify owner occupied or renter. There's a question here about why was severe 50% housing cost burden selected instead of 30%, which is more typically tracked for health equity. Both of the indicators are in the state health assessment, and we, I think, tended toward this indicator because it is a specific affordability measure that is also tracked in that severe housing problems indicator. So there's at least some consistency in those indicators. We could certainly look at, instead of using the 50% benchmark, using the 30% benchmark. All right, next comment here. Is that a strategy for home ownership could be to increase awareness of first-time homebuyer courses and, sorry, oh shoot, I apologize, I lost that question as I was reading it. A strategy for homeownership could be to increase awareness of first-time homebuyer courses and availability of down payment assistance. Thank you. So people have some idea of what those strategies might look like. Another observation from Tom here. A sub-indicator for decreases in homelessness might include rates among persons reporting severe, persistent, disabling conditions. This is universally collected for anyone accessing homelessness assistance interventions. Could also examine race, ethnicity, and pregnancy. So this is, it's just wonderful to know that there is that data available to be disaggregated. And we certainly could be selecting those priority populations based on what data is available. Question here, is there a reason the cost burden measure is only for renters? To connect to home ownership conversation, can we include homeowners? Again, there could be a discussion about broadening that the indicator that we track to include both renters and homeowners. And we could do that in consultation with some of the housing experts that we have with us today. Question here, how is homelessness defined in the Ohio Pregnancy Assessment Survey? We are looking it up. If we have any experts from Department of Health that can respond, please do that. Well, the questions and comments were coming in fast and furious there for a minute. And it looks like we have another one. Oops. All right, so Tom's got another question here. The National Low Income Housing Coalition's annual out of reach data provides an excellent summary on data on housing affordability, housing cost burden, and related wages required to afford housing. So general sense that there is a lot of data out there that we could use to be tracking several of the outcomes that we've mentioned here. There was another question about which of these indicators can be disaggregated for race and ethnicity. And with the exception of, I believe, the evictions filing data. Sorry, I'm just going to scroll back here through some slides. So these metrics that come here from the American Community Survey and HUD through the Comprehensive Housing Affordability Strategy data can be disaggregated by race and ethnicity. Eviction filings, we had an outstanding question, but again, that was not included in the housing needs assessment from OFA, last year. It sounds like from the homelessness data warehouse, we may be able to get additional information on homelessness and those rates of homelessness. So Tom, I don't know if maybe you'd be willing to chime in on whether this data would be available by race ethnicity. And then in terms of increased home ownership, the percent of households that are owner occupied, that would be available by race and ethnicity, unsure of the percent of mortgages that are delinquent or in foreclosure. And Tom has responded, thank you, that the homelessness data through the data warehouse would be available to be disaggregated by race and ethnicity. All right, we have a general comment from Ashley. I think for the prioritization criteria, we should add ability to disaggregate data by race and ethnicity. Thank you. All right. I think we are at the point where we can move on to our poll question. Which of the following housing-related outcomes should be prioritized in the SHIP? Increased housing affordability and quality, decreased evictions, decreased homelessness, increased home ownership. Okay, again, we encourage everyone to vote. And we thank you for your time and participation on this call. All right, we'll be getting ready to show you the poll results here. It looks like increased housing affordability and quality has a clear majority of the votes. Thank you. And it's available by race and ethnicity. So, all right. Now we will move on to our last priority topic area, which is economic conditions. The 3 desired outcomes we're choosing from are decreased poverty, increased income, and increased employment. So clearly some close connections between these outcomes. Again, the data sources for economic conditions are updated on an annual basis or more frequently. Data is generally available at the local level and can be disaggregated for subgroups. In the case of the pregnancy assessment survey, there is a little bit of a data lag that we can consider. So the first desired outcome is decreased poverty. Our indicators are the percent of adults who live in households at or below the federal poverty threshold, and then percent of children who live in households at or below the poverty level. Again, these indicators are easy to track, disaggregate, and get at the local level, including down to the census tract level. One potential con related to tracking decreased poverty is that there are several measures of poverty, and so that can create some confusion or even some controversy in the metric that's reported or the indicator that's tracked. In terms of potential for impact, there are evidence-based strategies that are rated to decrease poverty. There are not a lot of strategies that are shown through research to actually decrease rates of poverty, though. You have 2 examples here from What Works for Health, including earned income tax credits and local wage ordinances, which are sometimes referred to as living wage laws. Unlike a minimum wage increase, a local wage ordinance is a policy where a city or municipality sets a floor for wages for their employees and contractors at a wage that's higher than the federal or state minimum wage. Both of these strategies have some examples here in Ohio. Ohio does have an earned income tax credit, so the strategy here would be to make that tax credit refundable and or to increase the percentage of the federal earned income tax credit that the state of Ohio offers eligible taxpayers. Potential con is that these strategies might run into political feasibility concerns at the state and local level. The second indicator we'll look at is the second outcome we'll look at is increased income, and the indicator here is median household income adjusted for inflation from the American Community Survey. A potential priority population could be pregnant women, and there is an indicator in the Ohio Pregnancy Assessment Survey that tracks median household income for that population. Data from the ACS is easy to track, disaggregate, and get at the local level. There are evidence-based strategies to increase income. In addition to the earned income tax credit, early childhood education is rated to increase income for parents of children that are in education, early childhood education. And then the intensive employment support programs is basically providing wraparound supports to employees who are either in a job search process or in entry-level jobs and looking to move up a career ladder. And a specific example of that strategy is the New Hope Project. I just want to point out that Reem had mentioned earlier, co-benefits of some strategies, and we've already seen early childhood education come up in both the education and the violence and trauma segments of this conversation. So highlighting that opportunity to select strategies with multiple benefits. Okay. Oh, looks like we have a question here. Can we look at census tract data on this as well? Any of these metrics that come from the ACS, I do believe we can get at the census tract level and even disaggregate at least to some extent. Again, depending on the level of analysis that might require going beyond the public-facing or the easier to access data that's available from the census and might require additional analysis. So question, can you clarify the early childhood impact? Is that long-term or the help for parents now? And that was rated for increased income for parents of children in early childhood education. I'm not sure on the evidence related to long-term impacts and employment or earnings. All right. The next outcome we'll talk about is increased employment. We can track the civilian labor force participation rate from the Bureau of Labor Services, the federal government. The Ohio Department of Job and Family Services also produces local level data on the monthly and annual basis. One potential weakness of tracking this data is that there is limited disaggregated data available from the BLS, and that's available only on an annual basis for race and ethnicity. In terms of potential for impact, this is the outcome that has the strongest evidence and the most programs and policies that are rated to get movement on the outcome. Examples of strategies rated to increase employment are child care subsidies, sector-based workforce initiatives, and that is programs that help people move into entry-level jobs in specific sectors and work up through a career ladder with on-the-job training and additional education. And then a third strategy is transitional jobs, which are a strategy that's traditionally used with individuals that are hard to know how to employ and provides intensive supports, even subsidized employment opportunities as a transition to more stable employment. Looks like we have a question that just came in here. For employment, do we have an indicator that gets at employment quality, flexibility, benefits, etc.? We do not. We do not have a measure like that on the state level. Certainly is a concern related to this outcome that not all employment provides the supports that is likely to improve health. We actually published a brief on what works to increase self-sufficient employment, which we defined as employment that provides those supports that improve health. And one finding of that paper was definitely that not all employment does that. So thank you for that consideration. Question and consideration. Okay. Not seeing other questions. If anybody would like to raise their hands to talk about any of the outcomes, please do that now. Pause for a few seconds. All right. We'll go ahead and open our next poll question then. So which of the following outcomes related to economic conditions should be prioritized in the SHIP? Decreased poverty, increased income, increased employment. And please, again, we encourage everybody on the call to vote. All right. You need to keep letting those votes roll in. The faster you vote, the faster you can get off to lunch. All right. We'll go ahead and show you the poll results now. So decreased poverty received the majority of the poll votes. And a little bit of agreement on income and employment as well. All right, now we will turn it over to Amy.
Thank you, Zach and Reem, for walking us through all of those topics. So we have a pretty ambitious group here. I'm just going to kind of recap what the top poll responses were. And I think I got these right. So for the violence and trauma, it was adverse childhood experiences. Within education, it was chronic absenteeism. Within housing, it was housing affordability and quality. And within economic conditions, it was poverty. So thank you so much for your input on that. And I want to also have us talk a little bit about how all of these things fit together. Obviously, we can see that there are strong connections between these topics. And in the SHIP framework, our goal is to have 3 desired outcomes within each category. Obviously, it's really tough to prioritize within this one. We have 4. And so we just like to hear your thoughts on, we're not going to vote on this, but just if anyone wants to share any thoughts on, should we take on all 4? Should we try to pick 3? Should we combine any of them? Or any thoughts on that? Okay, got a few comments here. Taylor, I think the economic conditions is really broad, and it looks like the comment got cut off there. If you want to add to that, Taylor. And I encourage folks to raise your hands if you want to share thoughts on this. Okay, looks like we may have a hand raised. Ashley?
Hi, Ashley. So the question was whether or not we choose one per area, or if we do more per area. Was that the question?
No, the question is, should we include all 4 of these as desired outcomes in the SHIP framework, or should we try to narrow it to 3? Do we feel like this is too ambitious, too much, or should we combine any of these? So just focused here on the 4 things on the screen, on the slide.
I think we should choose all 4.
Okay. Okay, great. Thank you, Ashley. We've got a few more comments here. One from Taylor. I'm not sure what specific strategies we'll be able to take on the economic conditions, influences, and cross-cutting with other conditions. So this was the continuation of that comment about economic conditions being quite broad. So absolutely, it is a very broad category, but there are evidence-based strategies that can address income poverty and employment. So it is possible. And a comment, whoops, here from Tara. All right, I'm struggling to keep up with all the comments here. I saw one from Tara, but okay. These are all important to include. I do think elements of violence and trauma will be covered in other priorities, especially around substance use. And so that certainly as we look at adverse childhood experiences, several of those relate to substance use and mental health, and which will be addressed in the mental health and addiction category. From Jim, as I think about violence and trauma, I wonder if that is not more of an outcome of some of the other factors. And that's certainly a conversation that we've had quite a bit throughout this process, is that violence and trauma can be seen as an outcome, it can be seen as a driving factor, and there's really a lot of bidirectional relationships here. And so that's certainly a challenge. From Deb, I can see that economic conditions and housing have overlaps, absolutely, especially since we decided to focus on affordability. From Deb, okay. All right, do we have any hands up? Yes, Shell. Shell, make sure you enter your audio pin. We're not hearing you yet. Okay, she says we could combine housing and economic conditions. Okay. Okay. Not seeing any other hands raised. Here's another comment from Tara. One overarching question I have is around whether we're monitoring policy changes that are applicable to these priority areas, especially those that may move us in the wrong direction. I'm thinking of limiting access to SNAP and pending HB 200, and it seems important to think about other factors. I think that's definitely something that we can talk about in the strategy phase, and think about how the best way to monitor those kinds of things over time, and really using the SHIP as a tool or a framework to assess potential impacts of pending policy changes on our prioritized outcomes. And a comment from Taylor, if we choose childhood ACEs, would that fit more under maternal and infant health instead of community conditions? Certainly lots of connections there between ACEs and maternal and infant health, and we can think about the best ways to communicate that. Okay. Not seeing any more. Oh, nope. Okay. Fantastic. Well, this has been a really helpful conversation, and we appreciate all of the input and feedback that everyone has provided. And we look forward to our next meeting of this group, which will be July 25th. And this is where we will be really digging into the data on the selected indicators, looking at the baseline data, identifying priority populations, setting those targets. And so we encourage anyone with a background in data or epidemiology to participate in that call. But then also we want to make sure we have good representation from priority populations. And so encourage recruitment of additional members for that as well, so that we will be looking at priority populations for people with disabilities, different racial ethnic groups, and other characteristics as well. And before that meeting in July, we'll be sending you an update of the framework and where everything has landed with desired outcomes and indicators. Thank you so much. Remember to check the HPIO SHA SHIP page for updates. We will be posting a recording of this webinar. So if you want to share it with any other partners or folks in your organization, you can do that, and have a wonderful weekend. Thanks, everybody.